Welcome back. I'm Paul Mamelo, and we've been talking with Congressman Joe Sestak from the 7th Congressional District and Democratic candidate for U.S. Senate. Congressman Sestak, we talked a little bit about the health care bill and some of the deals that were cut. And of course, we all heard about the process that was used to finally pass that bill after everything that went on. I was wondering if you could explain to our viewers a little bit some of the process that went on there and some of your thoughts on some of the things that went on to finally get the health care bill passed.
Right. First we had the House bill, which I was a large supporter of, which actually removed from the insurance companies their antitrust exemption to where they're allowed to collude on pricing, and where we actually said that there had to be a public option out there to make more fair competition in the marketplace. And we better control prices by about 25% of a decrease in premiums in the next few years. But then the Senate had their bill, and it was determined that we would vote on the Senate bill, and then some of the ideas in our bill, which the President articulated in a speech, would be passed separately, and they would be combined as the President signed each of them in the White House. And that's what occurred. At the end of the day, it is a very significant step. We've taken the worst of the health insurance, not all, but the worst of their abuses out. Where if somebody, having paid for 10 years, except maybe missing one small portion of their payment for their health care insurance, all of a sudden gets cancer, by law, by what's called rescission, the insurance company can say, we don't cover you anymore. You made this mistake 5 years ago. To where if your daughter, like mine did, had a brain tumor at 4, she's 8 today, going on 22, but at 18 she wouldn't be able to get health care. Well, two things. One is no longer can you deny anyone coverage for a pre-existing condition, and children can stay on their health care, parents' health care plan to 26. We also covered millions of Americans, about 32 million with life-saving care, and this benefits everyone. We lose about $150 billion a year in lost productivity towards our economic growth because of the under and uninsured who are sick more often. And you and I actually pay for that care. If you're in a family of 4, about $1,100, because the emergency room doesn't eat it when they go in there for their care. The hospital passes it to an insurance company that, of course, passes it to us. And so what we do also is strengthen Medicare. So seniors don't have to do co-pays or deductibles for preventive screenings, nor does anyone. And we close the donut hole where they no longer have to pay 100% for $3,000 until $3,000 is reached out of their pocket for their drugs. They keep the 20% co-payment with the government. At the end of the day, we do all of that and save the deficit, $1.3 trillion. A much more productive workforce, much like when I was in the Navy. We had healthy, productive warriors who weren't looking over their shoulders to families that weren't covered. And think of the dividends to America like having all workers covered, like we are going to.
So in terms of the differences between the bills, we all heard about reconciliation and how the process was going to work. What are some of the major things that you feel still need to be done to strengthen the bill?
I think two things. First, as I mentioned just a little bit earlier, we need to remove the exemption that the insurance companies have from antitrust. Right here in the Philadelphia media market, where all the TVs reach, it covers about 42% of all Pennsylvanians, but one insurance company, health insurance company, has 80% of all the private health care plans. It's pretty much a monopoly, and it's that way in 95% of all health insurance markets. We need to get better competition. Second, we need to reward, and this is where you really begin driving down costs, doctors and hospitals for the quality of their care, not just quantity, how many times someone comes in. So for example, if someone goes in for a heart operation, a set fee today is given to the hospital. The earlier they get them out, one less day of hospital care, they get to keep more money of the profit, don't have to spend it on the care. But if they push them out too early and the person gets a staph infection and they come back in, we give them another fee for that. No, we say, wait a moment, you're going to have to eat it if they come back in with a staph infection. So you take that extra care for the quality of their care. So we have to change the incentives. And those are two major things that we have to move down the road on to control cost, now having covered everyone.
And the process, they were in the House bill?
Two major pilot programs were in the House bill to test and to try out this new system. And there were small pieces of it in the House bill, like this example I gave you in the hospital with a heart attack. We do that in the House bill. That's part of our Medicare savings. But to do it across the board for all health care is what we have to move towards. And we really do need, as we had in the House bill, the antitrust exemption removed. But that's where, as we talked earlier, special interests often influence senators too much. How could they not have stood up to the insurance companies at both ends of Pennsylvania Avenue to say that's wrong? You should compete like anyone else for the 40 more or the 32 million more patients we're going to give you. You shouldn't have antitrust exemptions. And that's when I get back to your original question earlier. We really do need principle to triumph over politics, to where people are down there willing to lose their job over what's the right thing for working families who've been forgotten too long by Washington, D.C.
So then, speaking about the power of the insurance companies and other lobbies, what did you think of the Supreme Court ruling that dealt with the power of corporations and elections? I know I'm changing subjects a little bit, but
how wrong and how harmful to equate against precedents of 90 years a corporation with a human being. What are we doing here? And that shows what goes wrong when you have a wrong senator who votes for these individuals like Arlen Specter did with Alito and Clarence Thomas. And so my legislation says, okay, can't pull it all the way back immediately till we get the right senators down there for the right Supreme Court justices. Right. But in the meantime, my bill says, let's make sure that those who own the companies, the shareholders, get to vote on who the money goes towards and gets to approve the advertising message, so that a CEO doesn't get to determine as a multimillionaire who they're going to support. It should be the owners of the company, the shareholders.
I think that would be a great solution there. Yeah, absolutely. I guess the other big issue that I really wanted to talk about is the economy and jobs. Can you talk a little bit about some of the important things we can do right now to
Absolutely. We have to move out much more aggressively than we had by focusing on small businesses. I'm vice chairman of the Small Business Committee because the majority of people in my district, as in Pennsylvania, work in a small business. Tool and die shop, the laundromat, a nanotechnology firm. And so what we want to do is incentivize them with the right tax credits to create jobs. We have to soak up 11 million unemployed. Those who lost their jobs, 8.5 million, plus 2.5 million who graduated from schools during this recession. In the last recession in 2001, small businesses of less than 100 people soaked up 80% of all jobs. So by a 15% tax credit for every new payroll job you create, 15% off the tax payroll, the Economic Institute says my legislation would actually soak up 5 million jobs in 2 years. Otherwise, it will take us until 2013 to get back to 2007's, before the recession's unemployment rate. Second, community banks. Small businessmen and women want to borrow, but community banks who lend to them are risk averse. They're uptight. It's a tough environment. They're holding on to some commercial real estate loans, and they're wary about, because they're going to go bankrupt, about lending out. So government should guarantee up to 98% loans to small businesses, credit worthy, and then we get going again. And that's how we have to focus. I have a score of these. The President spoke about 4 of them in State of the Union, but we've got to get this economy going again via the marketplace.
I think some of those would really be helpful. I want to talk to you in a little bit more detail about some of those issues, but we have to take a break, and we'll be right back.